This is QD Clinic. I'm Jack Cush with RheumNow. QD Clinic is brought to you by RheumNow.live. A lot of great lectures, a lot of great speakers, Saturday and Sunday, January 27, 28, in Dallas or online at a desk near you. Today's case, a 39-year-old flight attendant. She comes in for an earlier than scheduled appointment. She has lupus. She says she's not doing well. She thinks her rash has worsened. You noticed this at the last visit. You increased your dose of hydroxychloroquine. She's having more joint pain. And the real question is, how are you going to assess whether this is a lupus flare, whether this is controlled or uncontrolled disease, whether there's enough evidence in play that you're going to up your therapy, change your therapy, and whatnot. You know, the evidence is pretty strong that we're not that good at changing therapy even in the face of active disease. And does that not really speak loudly on the issue of we probably don't have great tools for active disease? So I got to tell you what I think are the things that we rely on that have been proven to be poorly predictive. And that would be change in autoantibody titer, change or drop in complement levels, and proteinuria in patients who actually already have documented lupus nephritis. Yeah, I know we hang our hats on these things, but they really suck, to say the least. Complement levels and change in titers, I always teach that you have to spend like somewhere between 4 and maybe 8 visits with a patient and monitor those, SM titers, double-strand DNA titers, C3 and C4 levels to see if they correlate with patient complaint and other objective evidence of worsening of disease. And honestly, in my practice, it's maybe 20% that I'm blessed, 20% of lupus patients, I'm blessed with the fact that those measures may correlate with activity, which means the vast majority of my patients, I'm stuck with good clinical judgment. Did they end up in the hospital? Were they hospitalized? What happened? Under certain circumstances, you can kind of predict that patient's going to flare, right? Pregnancy. There are problems of distinguishing lupus flare from pregnancy, but patients that with lupus, they often can get worse during pregnancy. If they've had a recent change in medicines, well, presumably you were increasing their medicines because they weren't controlled in the first place, or you're decreasing their medicines, and in fact, you're finding out you shouldn't have decreased their medicines, and now they're flaring. So there are certain setups that, it's much easier to say, this is probably active disease, and I probably need to respond. There are tools out there. There's the SLEAD-I, a number of measures that have a point score to them, and if they're more than 4 points, or certainly 8 or 12 points, oh my God, that's really active disease. There's the BILAG from, the UK, the British Isles Lupus Activity Guide or whatever. And the problem is, as a researcher, I've never understood the BILAG. It's very predictive when it gets used appropriately by people who truly understand it. But that's really clinical trialists and not you and I. I believe that when lupus patients are getting worse, the decision is made easier by the fact that lupus, when it gets worse, is not unidimensional, meaning someone's not going to get worse only by having, serositis only, or only by having a drop in just their platelet count. Usually, it's a multidimensional, multi-organ effect with some symptoms and organs lagging behind others. But again, someone newly diagnosed with lupus in the emergency room is not diagnosed only because they presented in renal failure. They're going to have plenty of criteria, right? So this is the case for assessing patients and being basically multidimensional in your assessment, and the fact that we need better assessments. I think we're evolving to this. If you followed the work of Andrea Fava and Michelle Petrie from Hopkins, they've got a lot of great information they've presented over the last 2 or 3 years. And we're going to have Andrea Fava as one of our speakers in our lupus session on Saturday, the 27th at 4:15 p.m., where he's going to talk about biomarkers in lupus. And biomarkers, I mean things that you're not measuring. And specifically, he's written a lot about IL-16. CD163, CD206 as proteins that you can measure in the urine, and guess what? They predict activity, they predict damage, they predict activity index, not chronicity index. They're way better than UPCR and the other things that you are currently hanging your hat on. I think this is going to be a great talk from a great researcher, Andrea Fava at RheumNow.live. Be there.